Hello to all of my wonderful constituents in Maryland's 8th Congressional District, and thank you for joining us in our forum on the basics of Medicare. We're hosting this event virtually, of course, because of the continuing COVID-19 pandemic. We want everybody to continue to maintain social distance and wear your masks, of course, but we miss all of our friends. We look forward to being together with you again in physical reality soon. But meantime, we wanted to go ahead and do our Medicare 101 virtual event, and we've got two sensational guests for you. And I want to first introduce Diana Varela, who's the public affairs specialist for the Social Security Administration, who's joined us to give us an overview. She started her career with Social Security Administration as a bilingual service rep in New Orleans. And she's been with the Social Security Administration for 25 years. She's held many positions there, including claims representative and field representative, and she's been working as a public affairs specialist since 2003. So Diana, we're going to ask you to go first, and then we will turn it over to your fellow panelist, Sharon Graham, afterwards. Welcome, Diana.
Thank you so much. And on behalf of the Social Security Administration, I would like to say thank you for inviting us to participate at this event. We know how important it is for you to make decisions about your Social Security benefits, and we are very happy to participate with the Office of Congressman Raskin on this event. Also, on behalf of all of us at the Social Security Administration, we wish that you and your families stay safe during this health crisis. And we would like to remind you that we are still ready to help you if you need us. There are two ways to contact the Social Security Administration during this health crisis. Number one is we invite you to visit us online, socialsecurity.gov. There are many things that you can do online. And of course, if you're unable to finish your business with us online, we encourage you to give us a call. You can call your local office. If you search the office locator, we will ask you for your zip code, and then we will provide you with your local office phone number. Please contact us. We are ready to help you. In the next slide, you will see in regards to Medicare, because that is the topic of discussion today, Medicare is really the national health insurance program that is given to people that are 65 years old, but we also provide Medicare coverage to younger workers that at any age become disabled and receive disability benefits for 2 years. They can get Medicare after 24 months. We also have Medicare eligibility to people who are disabled because of Lou Gehrig disease at any age. And they do not have to wait 24 months to get the coverage. We also provide benefits, Medicare benefits, to workers that are on dialysis because of kidney failure. 3 months after they start dialysis, they can get Medicare. And Medicare is very comprehensive health insurance coverage. It provides coverage for hospitalization, doctor's visits, prescriptions. We also provide Medicare. It provides services, for hospice, and we will have a representative that will talk to you a little bit more about specific services that are covered under Medicare. But for purposes of this particular section, I would like to provide to you basic information on the two options that people have in regards to Medicare coverage. In the next slide, you will see that Medicare, you can actually enroll in what we call the original Medicare. Original Medicare. The original Medicare is divided in different parts. Medicare Part A is hospitalization insurance. You don't have to pay a premium for as long as you have worked, paid into the Social Security system, and have 40 work credits. 40 work credits for most workers. You will earn those credits in about 10 years of work. We also have Medicare Part B under the original plan, and Medicare Part B is hospitalization insurance. Hospitalization insurance covers outpatient services, doctor's visits. It will even cover for services that are rendered in a hospital, but you do not need hospitalization. Under the Part B, people will have to pay a premium. There is a monthly premium paid per person. So if you and your spouse will have Medicare coverage and you get Medicare Part B, each of you will have to pay the premium. And premiums are usually deducted from your Social Security benefits directly if you are receiving your benefits. But if you're not receiving your benefits yet, there are other options for you to pay the premiums. We also have Medicare Part D under the original plan. And the Medicare Part D, these are actually private companies contracted by Medicare. Premiums, deductibles, and copays are different. It will depend on the plan that you select. And as I said, premiums, deductibles, and copays are different. And in our area, we have plans that are very, very affordable and plans that are more expensive. And we will talk to you about assistance that is available for those who have lower income and resources. Now, under Medicare options, we also have the other option that is the Medicare Advantage plans. These are private companies contracted by Medicare. And in our area, we have many plans available, and the premiums, deductibles, and copays are different. It depends on the plan that you select. And most of these plans will include prescription. They are more comprehensive. A lot of them are HMOs, and some of them even provide extra benefits such as vision, hearing, dental, which on the Medicare original plan, they don't provide these type of services. And some of these plans even cover lower out-of-pocket expenses. So those are the two options that you will have in regards to Medicare. And when we talk about the Medicare original plan, it is important for you to know that if you enroll in the Medicare original plan, because it is divided in different parts, it depends on your personal situation. You can take some parts first and wait to enroll in some others later, especially if at the age of 65 you are still working. And in regards to the cost of Medicare, what I would like to provide to you is information about the Medicare Part B premiums, because there is a standard premium. In the next slide, you will see the standard premium for the year 2021 is $148.50. In the next slide, please, you will see that that's the standard premium. But not everybody that receives Medicare coverage pays the same premium, because depending on your income, some beneficiaries will have to pay a higher Medicare premium. So take a look at this chart and take a look at who will have to pay a higher Medicare premium. That is for people that have income of more than $88,000 for single taxpayers or $176,000 for couples. Your premium, you pay the standard premium, but you pay a surcharge if you have incomes higher than the ones that I mentioned. And what I would like for you to take a look is, look at if you know more or less what is the income that you will have once you start receiving Medicare benefits, take a look at the surcharge that you will have to pay so you will be prepared. And of course, the premiums are different every year. You will have to know in the year that you file for benefits that you are eligible for, you will have to know what is the basic premium, and then you will have to add the surcharge. And the surcharge, once again, depends on your income. And another aspect that you have to know about the Medicare Part B premiums surcharge is that we will take a look at your income tax information 2 years prior you receive the benefit. For example, in the year 2021, we base Medicare Part B premiums on the income tax information of beneficiaries for the year 2019. It will always be 2 years before. And once you are on Medicare, we will take a look at your income every year. So we determine if you will pay the standard premium or the basic premium, or you will have to pay a surcharge. Also know that if your income has changed from what it was 2 years before, maybe because of you retire in the last 2 years, maybe because your marital status changed, your spouse is deceased, you got divorced, you and your spouse are living separately now, you can ask Social Security to review that income tax information because you had a life-changing event. Well, that's how we call them, a life-changing event, an event in your life that changed your income. It decreased your income from what it was 2 years before. And that is when you need to contact us. Just remember that. You will receive a letter. You will receive a letter, and the letter will explain to you what will be the amount of your premium. Just remember that if you had a life-changing event, the letter will tell you what are the steps you have to take in order for us to review that information. In the next slide, I would like to provide to you information on when is the best time to file for Medicare. Next slide, please. Let's talk about the times in which you will be eligible to file for Medicare benefits. If you can advance to the next slide, please. We have 3 enrollment periods. We have the initial enrollment period, we have the special enrollment period, and the general enrollment period. You'll see in the next slide, we're waiting for the next slide, please. Great, thank you so much. Okay, so as I said, we have 3 enrollment periods for Medicare. It is like having 3 opportunities for you to file for Medicare. Now, which one is the best one for you? It's going to be personal. I would like to provide you with information so you can make the right decisions. And what I would like to advise you also is that you start thinking about Medicare long before you are first eligible for, and that is at 65 years old. So, okay. Now let's talk about when you need to enroll in Medicare. And I can tell you that there are 3 enrollment periods: the initial enrollment period, special enrollment period, and the general enrollment period. What is the best period for you to enroll in Medicare? I can also tell you that it's going to be a personal decision. And what I would like to recommend is that you think about Medicare long before you need to enroll in one of these periods long before you turn 65 years old. Let's talk about the initial enrollment period first. The initial enrollment period, even your Social Security statement tells you, contact Social Security 3 months before you turn 65. That is the first opportunity that you have to enroll in Medicare once you are turning 65. The initial enrollment period is a 7 month period. It is 3 months before you turn 65 years old, the month you turn 65 years old, and 3 months after. Altogether, 7 months that you have to enroll in Medicare. If you enroll in any of the 3 months before you turn 65 years old, your coverage will begin the first day of the month you turn 65. If you enroll in any of the other months, you will have a gap in the coverage. Once you are 65, there will be a couple of considerations that you have to think about if it is the time for you to enroll, if it is the best time for you to enroll during your initial enrollment period. And one of them is going to be your health. Of course, your health is going to be the number one consideration that you have to take, number one aspect, but you also need to find out and need to know the type of coverage that you have once you turn 65. Because if you're still working, it might be that you don't need to take Medicare at that time. If you're still working at the age of 65 and you have health insurance coverage based on your current and active employment or your spouse's current and active employment, then your Medicare will be your secondary payer if your employer has more than 20 employees. You will be under what we call a special enrollment period. Your Medicare will be secondary, and therefore, if you are in good health, it might be that you don't need to get that coverage at the age of 65. Under that special enrollment period, for as long as you continue working, if it is you that has the coverage, or if it is your spouse, if your spouse continues working and your spouse continues having that health insurance coverage, you are under that special enrollment period. You are protected. If you do not need Medicare at that time, you can defer Medicare. Most people under the special enrollment period will take Medicare Part A because Medicare Part A is premium free. You do not have to pay for that coverage. It will be like having additional coverage and you don't have to pay for that. They wait to file for Medicare Part B because that is the one that you have to pay. And remember that if you are still working, chances are that your premium will be higher because your income will put you on a higher bracket and you might have to pay the surcharge. You are under that special enrollment period, and even after you retire or your spouse is retired, whoever has the coverage, you still have 8 more months to file for Medicare, and it's still considered under that special enrollment period. But what happens after 8 months? You or your spouse retire, you retired, 8 months pass by, and then what happens if you did not file for Medicare? Are you eligible to file for Medicare? Of course. But if you miss your initial enrollment period or your special enrollment period, you can only file for Medicare under what we call a general enrollment period. And as you can see, a general enrollment period is a very specific time during the year. It is only from January 1st, or well, I should say 2nd, through March 31st of every year. And the coverage is going to start in the month of July of the year that you file for Medicare. And besides a restriction in the time of filing and when the coverage is effective, you must know that there is a penalty for not filing for Medicare either under an initial enrollment period or a special enrollment period. How much is the penalty? The premiums will be increased by 10%. 10% for every 12-month period that you are 65 years old and you did not have health insurance based on current and active employment or based on your spouse's current and active employment. In other words, if you retire, you miss your special enrollment period, 5 years later, you need more health insurance coverage. You wait for 5 years, then your penalty will be 50%. You will always have to pay 50% in this example, and the penalty is permanent. You will always have to pay a higher premium. So thinking about Medicare is very important, and find out when is the best period in which you will have to enroll in Medicare is very, very important. I would like to also recommend that besides your health and health insurance, of course, you have to think about your health, not just now, but also think about any medical conditions that may be running your family and that you are prone to get one of those medical conditions. Also, the life expectancy is growing in the country. Do you think that your health will be the same now or in the next 5 years, in the next 10 years? What if you happen to live more than 85 years old? Do you know how your health will be at that time? You need to be able to think about not just get the information on the different enrollment periods, but also apply that to your personal life. We hear this in the office all the time. Workers tell us, I already have a medical condition. I need all the coverage that I need. But we also have workers that tell us, I have health insurance through my former employer. Why should I get Medicare also? It depends on a personal situation, the type of coverage that you need, the amount of premiums that you're willing to pay, and also think about your health, which is the number one factor that you need to think about when making a Medicare decision. In the next slide, you will see when your Medicare will start. If you file for Medicare during your initial enrollment period, and as I said before, your coverage will begin the first day of the month you turn 65 if you file for Medicare in any of the 3 months before your 65th birthday. In regards to how to apply for Medicare, basically we go back to the beginning when I told you the 2 ways that you have to contact Social Security Administration. In the next slide, please, you will see that you can file for Medicare online. And even if you are not ready to apply for your cash benefits, your retirement benefits, you can file for Medicare only online. You must have an online account. If you have an online account, the application is much, much easier. And even if you don't have an online account, you can still file online, but we will have to use other ways to verify your identity. But please, please know that filing online is very, very easy to navigate. The application is very friendly, and all you have to do is just answer some questions. The other way to file for Medicare benefits will be by calling us. You can contact us at the toll-free number 1-800-772-1213, or you can call your local office. We will schedule a telephone appointment so you can file for benefits. Either way that you choose to file for benefits, either online or by contacting us and scheduling an appointment, please know that we would like for you to contact us 3 months before you want your benefits to start. In the next slide, you will see a couple of Medicare applications that you will have to complete. Let's say that at the age of 65, you decided to take Part A only. Medicare part that has no premium free. And the reason why you took only Medicare Part A is because you were still working and you had health insurance based on your current and active employment. Well, you need to add the Medicare Part B later, and this will be the two forms that you will need to add Medicare Part B to your Medicare Part A. 40B, a CMS 40B, and a CMS L564. And the same time, we will need the same time, about 3 months before you want your coverage to start is when you need to contact us. In the next slide, please. We encourage you to visit Medicare website at medicare.gov because Medicare website has information on a specific coverage, but we will provide with that information. Our representatives from the Centers for Medicare and Medicaid Services will be providing information for you. But if you want to get that information, you know that can also be able to get that information online. At the same time, if you realize that you will be better off applying for Medicare and enrolling in a Medicare Advantage plan, you can find the information about the plans that provide coverage in the area where you live, and you can get that visiting the Medicare website, medicare.gov. If in any case you or somebody that you know needs assistance to pay for Medicare premiums, in the next slide, you see that there is extra help. The extra help program allows the Social Security Administration. In the next slide, please. The next extra help allows the Social Security Administration to provide assistance with the payments of the prescription drug coverage, premiums, deductibles, and co-pays, and you are able to get that assistance if your income and resources fall under certain levels. And also know that when people need assistance to get the premiums, deductibles, and co-pays of the Medicare Part B, they can get it through the state. In addition, the state provides a very good resource, which is the assistance. They have volunteers that can assist you to figure out, in regards to Medicare, what is your best enrollment period for you, depending on your personal situation, and also if you will be better off on a Medicare Original Plan or a Medicare Advantage Plan. You can get that assistance if you actually contact the Office of Social Services in the county where you live. In Montgomery County, you can contact the Office of Social Services in the county and ask to speak to a CHIP volunteer, Senior Health Insurance Program volunteer. They will be able to assist you. And once again, in regards to extra help, please, if you know someone in your community, someone in your family that needs assistance with the payments of the Medicare prescription plan, let them know. Social Security has extra help. With extra help, we will be able to provide the assistance that they need to pay for the Medicare prescription plan cost. And in the next slide, as a matter of fact, if you're able to help somebody to file for these benefits online, please do so. I invite you once again to visit us online, socialsecurity.gov. We have publications, we have information, we have benefits planners, we have certainly the applications for you to file for Medicare or any other benefits with us. And of course, you also have information in regards to your Social Security benefits and services. Please contact us online or visit us online, socialsecurity.gov, or you can give us a call at the toll-free number. Thank you so much. And do anybody have any questions? Congressman Raskin?
Diana, but I'll come back at the end. Thank you for that.
You're welcome.
Thank you for that wonderful presentation. That was just terrific. And I'm going to go now to Sharon Graham, who is the Regional Administrator and Staff Director for the Centers for Medicare and Medicaid Services in Philadelphia. And that jurisdiction includes Maryland, Delaware, Pennsylvania, Virginia, West Virginia, and Washington, D.C. And so Sharon's job is to lead and coordinate all the external engagement efforts for CMS in this entire Mid-Atlantic region. We're delighted to have you, Sharon, and the floor is yours now.
Thank you very much, Congressman. I'm so glad to be here. Thank you for having me. I am following up. I'm going to start my screen share here and just check in to make sure that you can see that.
Yes.
Terrific. Thank you. So I'm following up on the great presentation that you just heard from Diana at Social Security, who talked specifically about Medicare and enrollment and eligibility. I'll touch briefly on that and then also get into some more of the specifics about Medicare and the coverage itself. So first of all, as you've already heard, Medicare is health insurance for people primarily age 65 or older, and then also for certain people younger than age 65 who have certain disabilities, for example, ALS or end-stage renal disease, ESRD. And also for people who Social Security deems disabled. As you heard from Diana, there's a 24-month waiting period, and then Medicare will kick in for those people after 24 months. And so to be eligible for Medicare, of course, you do need to be a US citizen or lawfully present for at least 5 years. The picture you see here is the annual Medicare and You handbook. And I just want to call that out because it is such a great resource for people with Medicare. Every household receives one on or about the end of September prior to our annual open enrollment period, which starts on October 15th. And this book is just a great resource. It offers so much more information that I can provide to your constituents today about Medicare and what's covered. And also at the very back of the book is a specific appendix for your constituents about the plans that are available to them in the state of Maryland. So it's just an awesome resource. Every household receives one copy of this handbook every year. So I encourage you to take the time to review that. So what agencies are responsible for Medicare? As you just heard from Diane, of course, Social Security plays a key role in determining everybody's entitlement and eligibility to Medicare. So that's very important. For people who have worked for the Railroad Retirement Board actually owns a piece of that eligibility and entitlement, and also to a certain extent, even administering the benefits. And then for federal retirees, and I'm sure there's many of them there in your area, Congressman, OPM, the Office of Personnel Management, actually has a key role also in determining eligibility. But then again, once you're determined to be eligible for Medicare, the administration of your benefits transitions to us, to the Centers for Medicare and Medicaid Services. We don't play a role in the entitlement and the eligibility, but we handle all of the administration of the benefits once you are eligible for Medicare. So again, we have two components to Medicare: Original Medicare, or you can opt to enroll in Medicare Advantage. Once you're determined to be eligible for Medicare and your eligibility kicks in, you automatically receive Original Medicare. And that's what you see here on the left of the screen. So what does Original Medicare include? It includes Medicare Part A, which is primarily your inpatient hospitalization. Then you have Medicare Part B, which is primarily your outpatient lab services and things like that. You can always add, at your own option, prescription drug coverage. So it's important to note that prescription drug coverage does not come automatically when you become eligible for Medicare. You'll automatically get A and B coverage, but you have to choose to enroll in Medicare Part D. And because Medicare Part A and B do have out-of-pocket cost sharing, you can choose again at your own option to enroll in what's called Medicare Supplemental Coverage or Medigap coverage. And those are privately run health insurance companies that supplement Medicare and fill in those gaps by paying those out-of-pocket costs for you. And many people do in fact choose to purchase a supplement with their original Medicare. And what that does for many people is leave sometimes as little as $0 out-of-pocket costs, because the supplement supplements, again, what Medicare is offering with its healthcare coverage. Now, you can also choose, though, to have your Medicare benefits administered through a Medicare Advantage plan. Now, it's important to know if you choose to do this and to enroll in a Medicare Advantage plan, you still have Medicare coverage. It's just that you're choosing to receive your Medicare coverage through this Medicare Advantage plan. The Medicare Advantage plans have to cover at least what original Medicare covers. And in fact, as you see on this slide, they even do offer some extra benefits as well. If you enroll in a Medicare Advantage plan, you will of course have the Medicare Part A hospitalization coverage. You'll have the Part B outpatient medical coverage. Most plans will offer the prescription drug coverage as well and roll it all into one package for you. And of course, most of the plans will offer some extra benefits as well. And I'll talk about that a little bit more later. One of the benefits of enrolling in a Medicare Advantage plan is that those out-of-pocket costs that original Medicare has will actually be substantially lower. There will be out-of-pocket costs, and let me say very clearly here that if you elect to enroll in Medicare Advantage, you cannot purchase a supplement. So those out-of-pocket costs that come with a Medicare Advantage plan are those that you will in fact have to pay, but those out-of-pocket costs will be less than original Medicare if you chose to not purchase a supplement plan. So this here is your Medicare card. And by Medicare card, this is your original Medicare card. So every person, once they're eligible and entitled to Medicare, will receive this card in the mail. And I want to point out here that what's pretty new for CMS in the last 3 years or so is you'll see that the Medicare number, for those of your constituents who are older, they might remember that your Medicare number originally was, for most people, your Social Security number with a letter that followed it. And we recognize that there was a lot of potential for fraud there, especially for people who lost their cards, to have your Social Security number out there. So about 3 years or so ago, we switched to this new Medicare number, which is a 13 combination of letters and digits that represent a completely random assignment for people. So that's really new. And we encourage everybody to keep their Medicare health insurance card on their person, never share it with anybody except your health insurance providers. I know there's a lot of fraud that goes on out there. A lot of people are looking to get your Medicare number. We always encourage people to keep that number close to you. You'll receive this Medicare health insurance card when you're first eligible for Medicare. And as you heard from Diana, that's usually for people who are receiving Social Security benefits already. You'll get a Welcome to Medicare packet in the mail about 3 months prior to your 65th birthday. And then you have a 7-month window, of course, to enroll in Medicare, or you can always refuse to enroll in Medicare for reasons that you heard explained by Diana. If you do refuse your Medicare Part B, perhaps you have employer-sponsored coverage, for example, you can just follow the instructions in the package and refuse Part B at that time, and then elect to enroll at a time in the future that suits you. So again, we always encourage you to carry your card when you're away from home in case you do need it, but to share it primarily only with your healthcare providers. But knowing that some people will often misplace their health insurance card, you can always call our 1-800-MEDICARE phone number that you see there on the screen to get a replacement, or at our Medicare.gov website, you can sign up for your own My Medicare account and request a replacement card through your MyMedicare.gov account as well. It's important to also know that, as I said at the top of this slide, this is your original Medicare health insurance card, and you should always have it and always keep it. But if you do choose to enroll in a Medicare Advantage card, a Medicare Advantage plan, they will issue you your own card to receive health insurance care while you're a member of that Medicare Advantage plan. So don't throw away this Medicare red, white, and blue card. Just put it away in a safe place if you're in a Medicare Advantage plan, and you'll want to use their card to receive your health care benefits. I want to call out that right now we're in a period of time called the Medicare Advantage Open Enrollment Period. And you'll see on this slide that it runs from January 1st through March 31st. For those constituents who have elected to enroll in a Medicare Advantage plan, the enrollment will typically be effective for most people on January 1st. But from January 1st through March 31st, you have this new, not so much new, but this open enrollment period that's available to you as a Medicare Advantage enrollee. Perhaps you're trying it out and you decide it's really not going to work for you, or you don't particularly like the plan that you're enrolled in. During this 3-month window of time, you have the option to switch to a different Medicare Advantage plan, or even to drop the Medicare Advantage plan and return to original Medicare. And if you choose that latter option, to drop the Medicare Advantage plan and return to original Medicare, you can then pick up a standalone prescription drug plan that works with your original Medicare plan. It's important to know, though, that this option does end for people on March 31st, and it's only for those people who are currently enrolled in Medicare Advantage at that time. And as you'll see, if you choose to make any change, that change will be effective the first of the month after you make that particular change. So to talk a little more in depth about the parts of Medicare, parts A, B, and D specifically, Medicare Part A, as you can see here, covers mostly inpatient hospital care, semi-private rooms, and other general nursing drugs and information as you see here on this particular slide. For Part A, as I mentioned, there's out-of-pocket costs. If you were to go into the hospital and be admitted, for the first 60 days, for 2021, your out-of-pocket costs would be limited to $1,484 for the first 60 days that you would be in a hospital during that benefit period. And then if you happen to be hospitalized longer than that, then there's a per day out-of-pocket cost of $371 in 2021. So again, to keep in mind, those out-of-pocket costs are the reason some people will consider enrolling or electing a Medicare supplement plan. Medicare Part A also covers care in a skilled nursing facility. So what this means is if you need inpatient rehabilitation. So if you're in a skilled nursing facility, Medicare will cover you for up to 100 days in that skilled nursing facility. Medicare Part A also covers blood if you need that in an inpatient setting. It covers home health care and hospice care. And very specifically, if you're in a religious non-medical healthcare institution, Medicare will cover the medical components of your healthcare while you're an inpatient at the religious non-medical healthcare institution. So now, do you need to sign up for Part A? As you heard from Diana, it is free for most people. However, if you don't have those 40 coverage credits, it could cost you as much as $471 a month. That would be the high end. For some other people, it could be a little bit lower. Again, it all depends on for how many quarters of coverage we say you paid into the Social Security system. And as Diana noted, if you do have to pay, there are penalties if you delay enrolling. So we always encourage people to really closely check with benefits administrators they might have for their employers, talk to family and friends, and of course, talk to Social Security about your health insurance options. For people who do happen to have health savings accounts, there are penalties. And as this slide notes, they should talk to IRS about that because you don't want to be incurring any additional penalties for your health insurance coverage. Moving on to Part B, as I mentioned, Part B is really the outpatient or the medical side. So as you see here, it covers things like doctor services, lab tests, durable medical equipment, walkers, wheelchairs, crutches, things of that nature. There's also an outpatient home health benefit that Part B will cover if you weren't in an inpatient setting first. I want to call out that Medicare covers many preventive health services like the flu shots. We'll also be covering, of course, the COVID vaccine as well. Outpatient mental health services also covered by Medicare Part B. And as Diana noted, for 2021, there is a monthly premium for Medicare Part B. Most people are going to pay about $148.50 for their Medicare Part B coverage. And then when you do receive health insurance care, there is an annual deductible of $203 for 2021 that you must satisfy before Medicare will pay. And when Medicare pays for your outpatient health care, Medicare will pay 80% of the cost of the Medicare coverage, and then the beneficiary, your constituent, is responsible for the 20%. So again, those out-of-pocket costs are costs that a Medicare supplement would help for you to cover. And again, that a Medicare Advantage plan would be probably a lower out-of-pocket cost, but in fact, you would have to pay those out-of-pocket costs. So some of the things that Medicare Part A and Part B don't cover, you'll see here, for example, dental, eye exam, dentures, massage therapy, acupuncture, hearing aids, especially long-term care. If you were in a long-term care nursing home type setting, Medicare would also not cover that. As I noted when talking about Medicare Advantage, those plans do cover extra benefits, and many of the extra benefits that you see here are benefits that a Medicare Advantage plan will cover. So for example, you will receive in many plans routine dental care. You might have routine physical exams covered. Hearing aids especially are also covered by most Medicare Advantage plans. And so that's some of the trade-off of looking at a Medicare Advantage plan, is to have coverage for those additional benefits should you choose to enroll in a Medicare Advantage plan. So in deciding about keeping or not your Medicare Part B coverage, as I noted, you do pay a monthly premium, and in fact, you would have to continue to pay that premium if you chose to enroll in a Medicare Advantage plan. If you have Social Security, it's typically deducted from your Social Security check, or perhaps it would be your OPM check if you're a federal retiree, or your railroad retirement benefits as well. But Medicare Part B, if you continue to stay employed after age 65, it may supplement your current employer coverage so that your employer would pay first, or your employer healthcare would pay first, and Medicare would pay secondary to that. So it would be like having universal coverage and potentially no out-of-pocket costs. But for some people, they prefer to decline Part B and wait until perhaps they're otherwise retired to pick that up. But again, that's an individual decision, as Diana noted, and we always encourage you, if you are covered by employer healthcare insurance, especially, to talk to your benefits administrator about that. Now, do know that you need to have both Medicare A and B to buy a Medigap policy, or as I noted, to enroll in a Medicare Advantage plan. For our people who have coverage through the VA, say, for example, TRICARE for Life, or their civilian, it's CHMFA, Civilian Medical Program for Veterans Affairs, they also need to have Medicare Part A and Part B. And some small employers who do offer health insurance coverage can require that you pick up Medicare at age 65. But again, those are the smallest employers, typically those that have less than 20 employees. They will in fact require that you pick up Medicare Part A and Part B. Now moving on to prescription drug coverage, and it's easy to remember, D is for drugs. As I noted earlier, you have to elect to enroll in a prescription drug plan, so it will not happen automatically when you're eligible for Medicare. So you become eligible for Medicare and you want to have prescription drug coverage. You can, of course, look at your Medicare and You handbook to see those plans that are available to you, or go online to our website at medicare.gov and find out which prescription drug plans are available to you. It's important to note that those prescription drug plans are contracted with our agency, Centers for Medicare and Medicaid Services, and they offer a variety of plans. So it's important to look at all the plans that are available to you. Some offer what we call first dollar coverage so that there's no deductible. Other plans will require that you first pay a certain amount out of pocket before they offer prescription drug coverage. The drugs are often also covered through different tiers. So for example, drugs that are in a tier 1 will be less out-of-pocket cost to a beneficiary than those that are in tier 4, say. So we always encourage people to look at the prescription medication that they're currently taking and make sure that you are enrolling in a plan that covers your particular medications. And you can do that by, again, going to our website, medicare.gov, and doing what we call a prescription drug plan finder. If you enroll in a Medicare Advantage plan, most of those plans will offer prescription drug coverage as a part of that overall Medicare Advantage plan. And again, though, you want to make sure that your prescriptions are covered by that plan. So you can go online to medicare.gov, or you can call our 1-800-MEDICARE telephone line to get assistance from a counselor that can help you. So Medicare Advantage, and I've talked about this, so I'll just touch on it briefly. You always have Medicare, you're just choosing to get your Medicare through the Medicare Advantage plan. Like Medicare Part D, it's offered through private companies that contract with our agency, the Centers for Medicare and Medicaid Services, and you can get your prescription drugs also through the Medicare Advantage plan. And it will offer extra benefits, as I noted, hearing aid, vision care, some dental care too as well. Not every plan covers that, but most of them do. So it's important to look real closely at what's offered by each particular plan. The Medicare Advantage plans are traditionally health maintenance organizations, or HMOs. So in signing up for a Medicare Advantage plan, you are agreeing to receive your health care through that network of contracted providers to the plan. So Original Medicare, almost every doctor or hospital out there accepts Original Medicare. You should always look, but we estimate that over 95% of all physicians and hospitals are participating in the Medicare program. That's not always the case with Medicare Advantage. You're choosing a more limited network of providers. So we encourage people to make sure that their doctors and their hospitals are contracted to the Medicare Advantage plan that you might be interested in enrolling in. Now, when you are, whether you're in Original Medicare or a Medicare Advantage plan, you always have appeal rights should your health care be denied. In Original Medicare, you'll find out about that when you receive your explanation of Medicare benefits. You'll receive those explanation of benefits quarterly. And if a particular service, is denied that you believe should have been denied, your appeal rights will be explained to you in that explanation of benefits. And you have a window of time, typically it's going to be 60 days, to appeal that to an independent entity that will review your case and determine if in fact it should be covered. And if in fact your appeal is upheld, then the coverage will be paid. But if that first level of appeal is determined that you should still be responsible, just know that there's several other levels of appeal that you can follow as you move through the process there. Now with Medicare Advantage, it's slightly different because Medicare Advantage plans will often require that you get pre-approval for your healthcare services. So a plan may decide in advance of you receiving a certain type of healthcare service that in fact they're not going to cover it for you. And if that's the case, you can appeal that predetermination. Typically, you can do that within 14 days, and the plan has another 14 days to make a decision. Now, if you feel that getting that particular healthcare service is really necessary, there is an expedited process to follow that's only 72 hours long. But again, you can call the health plan directly, and their number is always on that special Medicare, that special card that you get for being an enrollee in their health plan. Or you can go online to the website, or to, of course, write in to appeal your case. And you can do that on the pre-healthcare service side. And also, as with Original Medicare, if the plan in fact denies your healthcare coverage after the fact, they will expressly outline the ways that you can appeal that denial through their own system, and know that it goes to an independent entity as well, so that it's a very objective review of your healthcare coverage. Now, Diana touched on this briefly about getting some extra help for those out-of-pocket costs that occur when you become eligible for Medicare. And first, there's the Medicare Savings Program, where the state of Maryland would help you pay for some of those healthcare costs. And I'd like to leave you with a 1-800 number for the state program in Maryland, where you can call to see if you're eligible for that extra help. And in Maryland, that number is 1-877-463-3633. 3464. And that is the state agency that administers the Medicare Savings Program. As Diana noted, if it's prescription drug costs that you need help with, you'll apply for that extra help through Social Security. And then the state also runs the Medicaid program as well as the children's health insurance programs in the state of Maryland. And that 1-877-463-3464 is the phone number that you would contact in Maryland to determine if you're eligible for Medicaid or the children's health insurance program. In the state of Maryland, we also have Medicare counselors through the State Health Insurance and Assistance Program that can be available to you in your local area. And that SHIP program, as we call it, is just really terrific in Maryland. And so if you'd like to contact the SHIP program for answers to any of your Medicare questions, their number is 1-800-243-3425. And again, I'll say that 1-800-243-3425. Those are local counselors right in your area who can help you. And of course, we have our general national number for Medicare, which is 1-800-Medicare. To translate that, it's 1-800-633-4227. So we have so many resources that are available to you. The slides you see here are those online resources that are available to your constituents. Our website, of course, medicare.gov. I encourage anybody with online access to go there and explore your Medicare benefits. It's also where you can look online for the plans that are available to you in the Medicare Advantage or the prescription drug area if you're interested. Of course, we have medicaid.gov for people who are eligible for Medicaid assistance. Socialsecurity.gov, where Diana works, is an excellent resource, especially if you're looking for your eligibility and entitlement to Medicare. Healthcare.gov is where the marketplace is. And the marketplace is the Affordable Care Act, where people who aren't otherwise eligible for healthcare coverage can receive healthcare through the marketplace. CHIP, the Children's Health Insurance Program, Insure Kids Now, and a lot of our information here, basics to Medicare, Medicaid, the marketplace, are found at our national training site. And there you can see the SHIP TA Center. I referenced the Maryland State Health Insurance Program. They have great resources available there at their website too. These are, again, some additional resources on some great programs that our agency runs. You can always find more information at medicare.gov. As I touched on briefly, we are covering the COVID vaccine for all Medicare beneficiaries. It will be free for all Medicare beneficiaries. And so we have a lot of information on our websites about that. And of course, as with Social Security, we have lots of different information channels, Facebook, Twitter, YouTube, where people can always go for additional information. And with that, I'll stop my presentation and see if we have any questions. Oh, Congressman, I believe you're muted.
Sharon, thank you so much for that tremendous presentation. Diana, thank you. You are both just a wealth of information for my constituents, and I'm making sure that we're going to, flash up all of the numbers to call or the websites to check out if you have further questions. And of course, you also can contact my office if you have more detailed questions about your personal situation. Let me just close with a couple of comments about some policy items that may be of interest to people who are looking into the whole Medicare question. Lowering the cost of prescription drug prices has been a critical priority for us in Congress for the last few years. And in fact, in the last Congress, we passed H.R. 3, which we named after our late beloved colleague, Elijah Cummings, the Elijah Cummings Lower Healthcare Costs Now Act, which would have given Medicare the power to negotiate with the big drug companies to lower prices, which is a power that Medicaid has, that the VA has, but Medicare doesn't have. And then we would have made those negotiated prices available to all Americans who have private insurance. And it also would have created a new out-of-pocket limit on prescription drug costs, setting it at $2,000. Unfortunately, the Senate last year chose never to take this up, but I think that President Biden and the House of Representatives are now in a very strong position to promote the negotiation of Medicare drug costs, which will lower everybody's prescription prices, both in the public and the private sectors. In the last pandemic relief package, we did pass important provisions for Medicare beneficiaries, such as expanding telehealth services to people using mental health services. And we also waived coinsurance for certain procedures related to colon cancer screening, such as polyp removals. So that is something that we were able to do in the last year. Obviously, the healthcare system is complicated, and we're doing everything that we can to make sure it's affordable and accessible to all Americans. And so I really want to thank our guests today for talking about the different provisions and how they affect eligibility for my constituents. And maybe I'll close with a note about Social Security, because obviously we want to protect the stability and the solvency of Social Security for future generations. Social Security has been a tremendously successful program. The administrative costs of it are less than 1%. Tens of millions of people across the country at any one point are depending on it, and it's our major social insurance system that we've got in America. So we don't have an official proposal in Congress yet that we've received from the White House, but I know that they're going to be serious about making sure we take care of the solvency issue that has been kind of kicked down the road for so long. That might involve a payroll tax on income earned above $400,000 a year to boost the solvency of the system. But that's just one proposal, and there are other proposals that are out there. I look forward to working with my colleagues and the people in the Social Security system in coming up with the solutions that will guarantee that Social Security is there for everybody, for our children, our grandchildren, and future generations. In any event, I want to thank our two wonderful guests today. Sharon and Diana, thank you so much for your hard work for the American people and to make Medicare accessible and understandable for everybody. And with that, I bid everybody farewell for the day.
Okay.
Thank you.
Thank you for having us.